Perfect. I adjusted.
Welcome, everyone. For all the participants as well, keep in mind that this is going to be recorded and it's going to be live on Facebook. So please, if you don't want your face to be shown, turn off your video so it's not public. And well, it's already 3 and 2 minutes. I think we can still wait for 3 more minutes for more people to join, and then we will start. All right, it's already 3:05, so I think we can start with today's conference. Welcome, everyone. I hope you enjoyed today's conversation. So I will start sharing my screen. Okay. So, as I said, welcome everyone. We're starting on the 4th day of the conference, Youth Mental Health on the Spot. So, as you already know, you can find us on Facebook by Mental Health of AEGEE-Europe. In Instagram, also you have access to our webpage, and whoever wants to contact us, you can also do it via email. So for this conference, we're also starting this crowdfunding. This is aiming just to cover the expenses that the conference costed. So if you feel like this is worth it and you want to contribute to this kind of initiatives, please consider donating. Okay, so for day 4, we want to understand the priorities of the European institutions and what can be done in policy and advocacy to improve the situation, not only from the political perspective, but also what can we do ourselves from the individual perspective as well. So we're going to start with an introduction by Laura Marchetti and Jennifer Oroilidis. Did I pronounce it correctly? Well,
that was very good, Laura.
Thank you. I was so afraid about that. Yeah, so these two women come from Mental Health Europe, and they will tell us more about it. Then we will have a panel discussion with all our speakers present today, followed by a break, and we will close with a workshop by EFPSA with the reflection groups in the end. So I will also share with you this initiative by Basic Access. So it's a student movement aiming to reduce mental health issues among students. And they do this in 3 different ways, by offering an anonymous chat, also by organizing different walks with students, and also organizing other kind of events to break the stigma surrounding mental health. They're also an open initiative, so if anyone wants to contribute or help them in any way, there's also very open to this. So with this, I would like to give the floor to Laura and Jennifer. It's all yours.
Thank you, Laura, and thank you to everyone for having us here. I will share my screen so you can follow the presentation that we are going to do now. My name is Laura Marchetti. I'm policy manager at AEGEE, and I will let my colleague to introduce herself.
Hi, everyone. Thanks for joining us today. My name is Jennifer Oroilidis, and I'm Junior Communications Officer at AEGEE.
So we are going to give you a first brief presentation about our organization and our work. But before starting that, we thought that maybe, given that also this is the last day of the presentation, we could try to make it a bit more interactive. So if you want, you can go on slido.com and enter the code #75737 and answer the question, what does mental health mean to you? I'm sure that you all have your own idea and understanding of mental health. You probably have been following other parts of this conference this week, so you kind of come to a point where you have your own understanding. So we would like to collect it and maybe discuss it with you a bit at the end of our presentation. You can also scan the QR code that you can see on the presentation, or again, I'll just repeat it as I will have to move on with the slide now. Go on slido.com and enter the code #75737. Now, without influencing you too much, I can give you what is usually considered to be the general notion of mental health, which is defined by the World Health Organization, which defines mental health as the general state, as a state of well-being in which every individual is able to realize his, her, or their own potential, using his, her, or their own abilities, and cope with the normal stresses of life. They can also work productively and are able to make a contribution to the society that they live in. So this understanding of mental health really places mental health on the same level of physical health. We also see often that poor levels of mental health can have a negative impact on physical health, and vice versa. Physical health problems can also lead to the development of mental health problems. So here we are talking about 2 aspects that are very related to each other, and they coexist in every and each one of us and are equally important. When we talk about mental health, we also talk about what are considered to be the determinants of mental health. So all of those aspects of life that can have an impact on our level of mental well-being. And here we are talking about education, employment, the relationship we have with others. In some cases, we talk more about things that are considered to be basic needs, like access to food, access to water, but we're also talking about income, housing, really all of those aspects that influence a person's life and can positively or negatively impact a person's mental health. In our field also, sometimes we talk about psychosocial disability, and to give you a better understanding of what is meant, is usually psychosocial disabilities are those types of disability or types of mental health problems that tend to be a bit more long-term and severe. And that because of barriers that we encounter in society, our own condition can become disabling, but not because the condition as such is problematic, but it's more that we might be living in a society that does not cater for our needs as persons with psychosocial disabilities. Another point to understand related to this, and more generally to our approach to mental health, is what we call the social model of mental health, or the model of psychosocial disabilities, which often is opposed to the biomedical models of disability or of mental health. So when people tend to understand mental health through a biomedical lens, they tend to see mental health problems as mainly medical problems. In other words, usually as an illness that needs to be cured and as something that needs to be treated solely from a medical perspective. However, the psychosocial model tends to have a bit of more of a broader approach to it and a broader understanding, where mental health and mental health problems are seen as a part of the human experience, given that these are not solely given by genetics, but there, as I was mentioning before, there might be social factors that influence the mental health of a person. And because of this reason, a medical approach that sees mental health problems as an illness is not broad enough, is a bit narrow, because it doesn't address all of those psychosocial determinants or those socioeconomic determinants that might have impacted negatively the mental health of a person, but it mainly focuses on reducing the symptoms without necessarily going to the root causes of the issue. So of course, at Mental Health Europe, we tend to have this broader approach that don't simply look at biomedical factors, but looks at the whole lifespan of a person and all of those factors in a person's life that can impact their mental health. And now I will give the floor to my colleague Jennifer, who will talk a bit more about the correlation between mental health and young people.
Thanks, Laura. So you've heard about mental health and the different models, but what about your mental health, the mental health of young people? To start off, I want to share a few facts and figures with you. If you look at our infographic on the slide, you can see that 1 in 5 adolescents may experience at least one psychological problem in any given year in Europe. So if you look at your university class, you probably know someone who has experienced mental health problems, or you might have even experienced them yourself, because mental health problems are way more common than you might think. And the second leading cause of death among 15 to 29-year-olds is in fact suicide. That's why talking about this, as we're doing today and as we've been doing this whole week, is so important. Another reason why young people are considered a vulnerable group when it comes to mental health is that more than half of all mental health problems that affect adults already start during adolescence. Young people are also less likely to seek support for mental health problems, and that's for a number of reasons, like stigma, lack of awareness, and difficulties in accessing services. So you might actually want to get help, but face barriers like too long waiting times or too high costs. So all of this does not really paint a rosy picture, but the good news is that it is possible to prevent and recover from mental health problems. And everyone can live a meaningful life while managing their mental ill health. So now, if we go to the next slide, the question now is, what can be done? What are some of the solutions that can minimize the risk of young people like yourself experiencing mental health problems? First of all, governments have to develop policies that address the social determinants of mental health. And they also need to invest in community-based services, which can be affordable counseling or youth services. Then the focus should always be on prevention, so that mental health problems don't even occur in the first place, right? And educational institutions like universities or schools have to become platforms for promoting mental health literacy, so educating you on the issue of mental health. Take, for example, physical first aid courses. Many schools offer this to their students, but we have no mental health first aid courses. Like, what do you do if your best friend has a panic attack? Or what can you do yourself if you experience mental health problems? So we need more programs at educational institutions that equip young people like yourself with more resources when it comes to mental health. Then another equally important point is access to leisure time opportunities. So that can be youth centers, sports facilities, or art spaces, because they are such an important place of stress relief and recovery support. And then all of this has to be combined with reducing stigma and improved awareness raising. And now Laura will tell you more about MHE and our work.
Yes, so now we touched upon more about what mental health is, how this can affect all of us and what it can be done. So it's maybe time to tell you more about who we are. As Mental Health Europe, we are the largest independent non-governmental network organization that works in the field of mental health. We are the largest for many reasons. First of all, we are very proud to have over 70 members in more than 30 European countries. And we have been active for more than 35 years. So we have actually worked in this field for many years. We also consider us independent because we have the internal policy of not accepting funding coming from the industry to make sure that our work is based on the objectives and values that are set by our members and are not conditioned by other aspects. And what do we do? I mean, we work on different fronts. I think it's already been touched here and there before. Our main goals are to promote a positive understanding of mental health and well-being, to work on the prevention of mental health problems, given that that's where the promotion of mental well-being starts. But also we work a lot to support and advance the rights of people with psychosocial disabilities and make sure that these are included in society on an equal basis as others. Our membership is very broad, not just in terms of number, but also in terms of range. We are very proud to include within our membership users and ex-users of mental health services. So here we are talking about people that have or had experienced mental health problems. We also include their families and carers, but we also have mental health associations that work nationally or locally. We have service providers of mental health services, professional bodies and research institutes, as well as individuals. So people that are not affiliated with other associations, but they are interested in the topic and they would like to contribute, so they can join our membership as individual members, not as associations. And what do we do more specifically? You will understand in the rest of this presentation, but more very generally, we work to advocate for positive mental health and well-being to be a priority in policy making in the European health and social agenda. And this is related to the fact that we believe that mental health is not merely a health issue, it's way much broader as it relates to the socio-economic determinants we were discussing before. We work closely with European institutions, but also other international bodies like the United Nations or the World Health Organization, to mainstream mental health in all policies and promote an approach to mental health that is based on recovery and not solely based on medicine. We also work a lot with our members to use their own knowledge and their own expertise to get a recommendation that we can then pass on to policymakers at the European level. So we really try to be a bridge between our national and local members to the European institution, but also other international institutions as well. We continuously try to champion the respect for human rights, as many people, especially those people that have more long-term mental health problems, can often have their rights violated. And here, just to give you a better understanding, we are talking about the fact that in some national legislation, some types of mental health problems can lead to the deprivation of legal capacity. And this can lead in turn to the violation of some human rights of these people. So we try to work a lot to make sure that the human rights of everyone, in particular people with psychosocial disability, are respected. We also ensure that the voices of people with mental health problems are heard across Europe. And this is in relation to this bridge building activity that we try to do. We raise awareness to end mental health stigma and discrimination, and this is one of our biggest activities, since one of the main barriers to understanding mental health is the stigma around it. And finally, we build the capacity of our members to do their work at the national level and try to also support them in their own activities and efforts. Now, before giving back the floor to Jennifer, we decided to structure the rest of the presentation, giving you some sort of case studies of activities we did in the past, both for policy and awareness raising, so you can have a better understanding of our work, of what it can be done, but also how you can get involved. This will be a conversation that will continue this afternoon, but we thought that this concrete example would be a good way to start. So Jennifer?
Thanks, Laura. So last year we launched the very first European Mental Health Week, which was an online campaign to raise awareness about the importance of mental health during the pandemic and beyond. We also wanted to highlight the urgency to take more action against stigma and discrimination of people with mental ill health. The pandemic put a new spotlight on mental health, as many people maybe for the first time experienced mental health problems. So following last year's theme, Together We Can, we wanted to highlight the importance of community and solidarity. If we go to our next slide, I can present to you this year's, so what we have in mind for this year. So this year's European Mental Health Week will run from the 10th to the 16th of May under the banner Mental Health Matters, now more than ever. Over a year of pandemic, coronavirus restrictions and lockdowns put a strain on many people's mental health. And what's important to highlight is that we are all experiencing a different pandemic. We are all impacted by it, but in different ways. Some of you might experience the loss of a loved one or miss family and friends. Others might have lost their job and feel stressed, anxious, and uncertain about the future. This week is a chance for everyone to come together and talk about all things mental health, share their personal stories and how they are coping and what is helping them, and again, emphasize the need for more action, focusing on advice and support. We're planning a couple of activities throughout the week, like a bunch of Instagram live sessions, where we will have conversations with mental health champions, so people with lived experience of mental health problems, who will be sharing their stories, and also experts, some of our members, who will talk about mental health services and different sources of support. So if you would like to find out more, you can go to our website. The link is on the slide, or simply follow us on Instagram, where we will be posting more about this. And now it's back to my colleague, Laura.
As a policy activity, as I was saying before, we try to work a lot with European institutions, and one of the institutions with which we work the most is the European Parliament, where we established a coalition for mental health and well-being that includes various members of the European Parliament. Now, I'll show you a couple of videos so you can grasp a better idea of what we do, given that also some of these people that are members of the coalition will be with us later today during the panel. So this is the first video. No, sorry. The coalition as such works with a series of co-chairs, one of which is an MEP from Malta who will be with us during the panel. And he has prepared a bit of a short message to go a bit more into depth about mental health and the work that can be done.
Time that the European Union starts to talk about a unified approach to mental health and well-being. For this purpose, I have accepted Mental Health Europe's invitation to become one of the coalition chairs. The COVID-19 crisis has shown us how imperative it is for our societies to have a cross-border collaboration on a range of issues, be it resource allocation or information sharing. And mental health should not be exempted from this. As the Socialist and Democrat chair of this coalition, I will be working alongside Mental Health Europe, the other co-chairs, and all members to bring mental health to the forefront of the agenda, also when discussing a European Health Union. It is crucial to understand that 1 in 4 will be affected by mental health issues at some point in their lives. Around 450 million people currently suffer from various conditions, proving that this is a topic which affects each and every one of us. As we speak, 84 million of these are found across the European Union. Some of them are our family members, our neighbors, or our co-workers, at times even ourselves.
So I still haven't figured out how to do this. Yes, now it works. So what do we do with the coalition? Well, we try to work with various MEPs to influence the European agenda and to make sure that all of those policy and legislative files that pass through the European Parliament have an approach that is in line with respectful mental health policies. Because again, mental health is not just about health, but it can cover various aspects of policy making. And it is important then for us to make sure that different policies that go way beyond specific health-related policy take this into account. So, and how we do this? Well, we do this in many ways. One way is to try to collaborate with MEPs and their assistant to, for example, table amendments for certain piece of legislation, to have meetings with them to make sure that if they need support from our side or vice versa, we can find common ground to work together, and also through events that we do that are often open to the public. So this is, for example, for instance, an example of an event we had last year in the European Parliament that was around the notion, like around the need to call for a European mental health strategy. This is something that it has becoming also from some member states, like Finland, for instance, where there is an interest in having a more coordinated approach to mental health at the European level. So there is certainly an interest to work toward this. So, for instance, here we had an event with some of our MEPs, but also other stakeholders, to discuss about the possibility of having a strategy for mental health in Europe that would cover different topics, not simply the topic of addressing the challenges of people that already have mental health problems, but also ensuring the protection of those groups that are in vulnerable position, but as well as covering issues that are related to work and mental health, given that we know that work environments can be very positive for the mental health of a person, but can also have a negative impact. Another example of an event that we had last year in the European Parliament was about the mental health challenges for the LGBT community, as this is one of those communities that tends to be more at risk of discrimination and violence. We also noticed that they are more at risk of experiencing mental health problems. So we had an event in the European Parliament with various MEPs and in collaboration with AEGEE-Europe to discuss what it could be done and what are the challenges, particularly vis-a-vis COVID-19, given that, as we've mentioned before, the whole pandemic has had an impact on the mental health of many people, particularly those that are already in vulnerable position. And now back to Jennifer.
Thanks, Laura. So you can see we are very active on social media. As I mentioned, we have an Instagram account where we post lots of tips on how to look after your mental health. And we also talk about some of our policy work. So you might have recognized in the video some of the explainers that Laura showed to you in the beginning. And we we usually break down the sometimes complex policy work into easy to understand explainers. So if you would like to learn more and stay up to date, feel free to follow us on Instagram. And there you can see again the beautifully curated account. And yeah, this is one of example of guides we publish with tips like following a daily routine, even if you're studying from home. Then exercising, of course, does not only benefit your physical health. If it's possible in your area, try to spend time in nature or even go for a walk. Online, there are lots of great videos on breathing exercises, which can help with anxiety. And of course, try to take breaks in between work and studying. And don't be afraid, if it all gets too much, to seek professional support. And sometimes it might be helpful to take breaks from checking the COVID news. So this is an example of guides that we publish with tips that might help you in your daily life. And if you'd like to find more, you can find them on our website or our Instagram account. And now Laura will tell you more about our COVID policy work.
Yeah, so as you can probably imagine, last year was quite packed with work and opportunities to improve our work for us. From the very beginning, it was clear that the COVID-19 pandemic was having an impact on the life of many people, starting from the level of stress and insecurity that it comes with not knowing a new disease, to having to be forced into lockdown and having to social distance ourselves and having really to disrupt our whole life for a period that at the time it seemed only temporary, and now is becoming quite normal. So already from late March, early April last year, we changed a lot of our work and priority to try to address some of the issues that were emerging with the new pandemic. And what we did is that we created a web page on our website, which you can find still today. We really tried to kind of create a sort of a hub with all of the work that we did, both from the policy perspective, but also the awareness raising perspective. So if you go there, you will find a lot of material in case you might think that you need support for your own mental health, or in case you might be interested into exploring more policy work when it comes to mental health. So on the screen now, you see an example of some of the activities that we did last year related to COVID and policy and mental health policy. So we released, for instance, a position paper to address some of the foreseeable challenges in the aftermath of COVID when it comes to mental health. We also published an open letter directed to the Commission, to the President of the European Commission and the President of the European Council, to ask them to boost mental health policy. And this letter was signed by various MEPs. We published a statement to make sure that the rights and the needs of people in vulnerable situations would not be forgotten, for instance. We also created a series of interviews with our own members. You can see 3 of them here on the screen, given that they are the one working on the ground and they are the one that have more concrete and tangible knowledge. We really wanted to kind of give them a platform where they could talk about their work and talk about what they were doing. So we created this interview series with also the idea that other people, by reading this interview, could grasp tips and extra knowledge to address some of the issues that they were experiencing. Another piece of work that we did that was turned out to be extremely helpful for many people, we created a map of helplines. We already had one that collected all the European helplines to support the young people and their mental health. We now created an ad hoc one about COVID, since many countries started to open helplines dedicated to providing mental health support vis-a-vis COVID. We try to collect them all into a mapping so that this could be a kind of one-stop shop for anyone that needs to reach out and get support on mental health because of the impact that the COVID pandemic has had on their well-being. They can go on our website and search by country and get the contact of the support that they could reach out to. And now I think we are coming to the end of our presentation, where I will pass on the sharing of the screen to Jennifer.
Yes, thanks, Laura. Give me 1 second to choose the right screen. There we go.
Yeah, so I mean, this is more to also discuss with you, although I'm realizing we are going a bit ahead of time, the results from the Slido survey that we did, but I'll let Laura, like the other Laura, decide whether it's the case, or maybe we can leave this for the panel, given that we are 8 minutes behind time.
No, it's fine. I think, yeah, you can conclude your introduction.
Okay, thank you. I don't know if Jennifer, you would like to say anything, or?
I mean, one thing that immediately caught my eye is essential to healthy life, because that's what we always say, our mental health advocate, that there's no health without mental health. And I think all of the works that you contributed really summarize well the week and our presentation. What do you think, Laura?
You know, I think they really touched upon different points. I'm particularly happy to see that there isn't, that the understanding of mental health is not so medical as often people, as it is in some cases, as you talk more about well-being, understanding the state of a person's feelings. So it's not about having an illness or a disease, but it's a bit of more of a broader topic that it's also a bit more complex. So I'm quite pleased.
Perfect. Then I think it's time for me to stop sharing my screen, and then you can continue. All right.
I don't know if there is any question, but I also not sure if we have the time, and we should maybe just start with the panel. I see MEP Maria Walsh has joined us. Hi.
Well, after the break, we will have a lot of time for the audience to make questions as well. So maybe we should proceed.
Yes.
Well, welcome to all the new speakers that just joined. So before starting with the questions for the panel, can you all briefly introduce yourselves? Maybe we can start with Maria Walsh. The floor is yours.
Hi, how you doing? Good afternoon, everyone. I'm zooming in from the west coast of Ireland in a very small rural community called Shrule, just on the border between Mayo and Galway on the west coast. And I often like to introduce my exact location for COVID health and safety, but equally because I think it's so important when we talk about mental health. And the impact it has on younger people, and the stigma and taboo that is associated with mental health and well-being, that it's really important to highlight your location, because I think for me, I believe mental health affects not just those living in the most rural areas, but also urban, young and old, regardless of your orientation, creed, color, mother tongue, and of course, gender. it is really important that we begin to highlight that each and every one of us has mental health and well-being in order to lift that. But long story short, my name is Maria Walsh. I am a young, very proud to say the youngest Irish MEP at 33. I'm a first-time candidate in the sense that I didn't grow up in party politics, and I certainly didn't envision myself getting into politics when I was in school or in college, but I was very involved and impacted by social issues and how to best create a community for my friends and my family, and begin to just make positive change and purpose-led change versus often what we see now in the world and across the political landscape. For me, I ran on two things in the Euro campaign 2019, a few other things, but these are the two big things I should say. One was how to connect those that feel disconnected to the EU institutions. And I think things like this are absolutely essential because you begin to carve out the impact policy and legislation has, but also begin to hear and listen to people on the ground who need to see change and need to see it at a much quicker pace and faster pace than we see it now. And the other was on mental health. So within about a 10-mile radius of where I'm now, we've lost a number of citizens through extreme pressures of mental health. I was a young teenager when I first heard of someone under the pressure of mental health, and I always was scratching my head thinking, but why can't we, and how can we make it easier, and why can't we talk about it more? So bit by bit over the campaign, I kept talking about mental health and the fact that it needed to change and we needed to be more inclusive and actually put more emphasis on people's well-being versus what we often hear, the economy, the latest policy change, the latest policy paper, the latest trade deal. When for me, I believe if we can have citizens who can put their feet on the floor and head off to work, to study, to volunteer, regardless of where they live within the EU, that we're actually serving the people in a much more impactful way. But you've asked me to only speak for a minute, and I've 100% gone on a tangent there. But I want to say I've been looking at your program. I think it's been wicked, and I'm kicking myself that I didn't connect earlier in this week. And I'm really looking forward to the roundtable and to hear how we can all work together at making mental health and well-being a competency of the European Union, where in actual fact right now it's not. So I'll be leaning on everybody to kind of open up and create innovative and more sustainable ways that myself as a young policymaker can support citizens like yourself and others. So with that, thank you very much.
Thank you very much to you, Maria. Then I will pass the floor to Miriam Panning. It's all yours.
Hi. So yeah, I'm Miriam. I'm from Germany and I'm 25 and I'm a master's student in work and organizational psychology. And I'm here today to represent EFPSA. EFPSA is the European Federation of Psychology Student Associations, and I'm the policy coordinator of that organization. And yeah, what else? That's basically it.
Thank you for sharing. I'm sure you will have a lot more to say afterwards with the questions. Now I would like to pass the floor to Ramón Nogueras.
Okay, hello, good afternoon to everyone. I come here representing myself, I guess. I am a psychologist, and I think I have been invited because I spent a significant amount of my time speaking about psychology and doing science communication on psychology. And I also have some extensive experience in psychotherapy. I have been working as a behavioral psychotherapist for 20 years. And also, I am a university professor, so I have had my first share of experience dealing with psychological problems with youth people, particularly people on the age of college students, that kind of collective.
Thank you, Ramón. Laura Marchetti, you're next, if you want to say some words.
And very briefly, I mean, I've been talking already for half an hour. My name is Laura Marchetti. I'm policy manager at Mental Health Europe. I've been working for MHE for the past 4 years, and before that, I was active in the human rights and disability field. So I come in with not with the professional knowledge of Miriam or Ramón, or with the political knowledge of Maria, but more from the kind of NGO and activist background. Yeah. Thank you.
Thank you all. We're missing 2 more speakers that will soon join. So now let's proceed with the questions that we had prepared for you. So the first one will be, how do you see the situation right now regarding policymaking in youth mental health? Can you briefly explain what are now the priorities and what is being done about them?
Well, who goes first?
Feel free to open your mics and discuss. I would like to have an organic conversation.
I guess it's going to depend on the country, obviously, but around here in Spain, the answer is none. There's nothing. I mean, one of the historical complaints of my profession is that we lack a significant amount of psychologists in public healthcare, and one of our demands, which has grown stronger every year, is that the administration, the government, agrees to increase the presence of psychologists in primary attention, and also to increase the presence of trained psychologists in universities, high schools, and other educational centers. Okay, but as of this day, there's little. I wouldn't say nothing. Maybe I was too, I know, too enthusiastic, but there's little in the way of attention to mental health, and not only about young people. I think this showcases a general trend of neglecting the importance of mental health, or as Laura and Jennifer very well explained, this is something that I enjoyed of their presentation, to treat it exclusively as a biomedical problem that you treat mostly by dragging the shit out of people.
Sorry, Laura, were you about to come in there?
Me? No.
No. Oh, sorry. Just to add there, I think from and picking up from Ramon's points, from the EU institution side, from the Parliament side, there is beginning to be a lot more talk on it due to the pandemic and the impact individuals are experiencing, and the fact that citizens are shouting from the rooftops about it. I think the next pandemic will be our mental health one, and in many ways, I don't know whether we've gotten there. And I say this with great respect to anybody who may have lost someone within this pandemic, but I don't think we would have gotten to the state we're in now, with the opportunities to increase and highlight the impact mental health has on us without the pandemic as fast as we've experienced it. And I hope I'm explaining that clearly. Within the Parliament, working with the Mental Health Coalition and the Alliance with AEGEE-Europe, we're trying to create a European year of mental health. But what does that really mean? Well, in many ways, it's a great PR opportunity for us to start and picking up the energy from Ramón, and I hope I'm pronouncing your name correctly, sir, that we begin to start embarrassing finance ministers and prime ministers and leaders of countries to actually start looking at mental health of their citizens. Here in Ireland, we have, I wouldn't say a great mental health support system, but we have somewhat of a decent one. There's an awful lot of pockets. So particularly when we talk about younger people, there's length in waiting lists for younger people to get seen and supported. That pressure falls on them as a service user, as well as their carers and community members and schools. And then in and around the 16 to 18 age bracket, we have a huge fall off because they simply fall through the cracks because we don't have support systems in that. What makes me a little bit fearful with the pandemic, and I talked about the opportunity there like 60 seconds ago, but what makes me a little bit fearful is the comfort some organizations in Ireland have who provide mental health services on just honing in and delivering services now virtually. And I think a hybrid model is wonderful. But when I speak to more and more constituents, the one-on-one is face-to-face is very, very significant versus just encouraging a more isolated and spacious treatment. But with that said, I'm going to channel Ramon's points again. Like it's not enough, and from a nationalist perspective, all I can say is it's similar to other EU countries, the Band-Aid effect, where we'll throw money at problems but not enough, and we don't put it in the right places, and then we're chasing down the clock and wondering why GDP is growing and then why we have more and more reactive care versus proactive care. And I hope it comes up, and no doubt it will, the Finnish model, where they're teaching and educating younger people to understand vocabulary and what transition periods means within the mental health and wellbeing space, I think is where we all need to be channeling. But across the EU, I don't see a number of best practices other than that youth Finnish model that's there.
Yeah, I also have to agree with Ramón that nothing really is done in Germany. There's a lot of talk about, well, school children are suffering so much from not seeing their friends, stuff like that. And every third child is showing some signs of mental ill health, but there's nothing really done about that. And I think sometimes in politics it's used as like a straw man argument, kind of. It's like the opposition often use it is for opening the schools, for lowering the lockdown, lowering the regulations, and for opening the schools. And yes, seeing their friends and being in a more regular environment certainly will help children and young adults. But I think the harm is already done, and just going back to school won't fix that. And I also have the feeling that if something is done, it's not very well thought through. So for instance, in Germany, they just founded a new kind of voluntary service that I saw it in the news, and my immediate reaction was, this is nonsense. This won't work. I did a very, very similar thing. I actually did the precursor of this new voluntary service myself for a year, and I have to say no one will, or not no one, but very, very few people will sign up for it because it's just not thought through. And I'm just wondering, you invest a lot of money and do this PR stuff and whatever, but have you once asked someone, like a focus group or just young people, and ask them, well, would you like to do this actually? Because then they probably would notice that there is a great discrepancy between what they think would be a great scheme and what young adults actually want to do in their life, or what certain characteristics they have to join this scheme. So I think there's a great disconnect between politics and people who are disadvantaged, people with disabilities, people who are not highly educated, people with immigrations. So I think that's, at least in my perception at the moment, the issue in Germany.
To kind of complete what is it has been said until now, which was actually quite to the point and with which I agree a lot. It is true that from a European perspective in the past, if you want, not much has been done, and usually the reason for that is that when it comes to the competencies related to mental health, these are not European competencies. These are more competences that belong to the national member states, or they are shared competences. So usually what you would hear from EU institutions, the Commission in particular, would be that this is not their place to legislate. But we have seen in the past year that there has been quite of a change, and as MEP Walsh was pointing out, the pandemic has really put put a spotlight on mental health and the need for better coordinated action. So us as MHE, but not only us, MEP Walsh and other MEP are really trying to capitalize on this to show that there is a need for more coordinated EU action on mental health that looks at well-being and it looks at prevention. And this is because if I think about the action that have been done from the EU perspective in the past, usually these have mainly been channeled through the use of EU funding to provide community-based services. So the general understanding that big institutions like asylums or other mental health institutions actually do more harm than good. So some action has come from there, so through funding to not go and sustain this type of institution, but provide services closer to the people. However, we see that this is not enough, because here we are talking about providing services and access to services to people that sure have mental health problems and they need to receive support, but we're not doing much when it comes to prevention, for instance. And this is something that we try to call for a lot. And it is also true, and I think this was raised by MEP Walsh again before, we saw this tendency with the last crisis that we had over 10 years ago, the economic crisis, to focus on GDP, to focus on austerity measure and make it doing cuts. And now we know that that had huge social and mental consequences for people and for societies. And we're really trying to advocate for a different direction to be taken now with this COVID pandemic and the economic consequences that it will have, because we're not really in a position to save GDP and have GDP growth while we see the rates of mental well-being of entire society be weakened day by day. So we really try to work towards a different approach as a response to this pandemic.
If I may.
Sure.
Just so you get an idea on how things work around here in Spain. I don't know if it's representative of the situation in other countries in Europe. Okay, basically here, if you go to the national healthcare system and you manage to get admitted to see a psychologist over there, first you have to go through primary attention, where they usually will start medicating you. 80% of antidepressants and anxiety medication prescribed in Spain are prescribed in primary attention, not psychiatry, not psychiatrist, no, primary attention. So you come to the doctor, you are a young person, you are stressed, you have anxiety, you are depressed, whatever, and you come to your doctor and you tell him or her about your situation, and obviously they do what they can. I'm not blaming this on the doctors, okay? They come from a biomedical model, so they react according to that, and they use the resources they have, which usually is giving you drugs. So also, if you reject the drug therapy, usually you won't be admitted for a psychological treatment. So usually, in order to be admitted, you have to either take drugs or lie about taking drugs. Then, if you go through psychiatry and you manage to be admitted for a psychologist here in the public healthcare system, usually you'll see your psychologist once a month, if you are lucky. Usually it will be once every 3 or 4 months, which means that you are basically fucked. You are on your own. Of course, then if you can pay for private insurance or you can pay for private therapy, then you can see a psychologist, okay? Which is something that obviously also it's its own world with its own problems. And I have spent 10 years fighting about, because my profession here in Spain, and I have on good authority that is more or less the same in other countries, is riddled with pseudoscience, bullshit therapies, and smoke sellers. Question is, you have to look at the incentives, okay? And the incentives for the authorities are going to usually be on the side of short-term solutions. Recently, there's been this huge controversy because the government has said, hey, we are thinking about your mental health. We are going to increase the number of psychiatrists, and we are going to invent some new shit, which is pediatric psychiatry, which makes me rage. Why the fuck do small children need a psychiatrist? But it's fast. Getting more doctors to prescribe more drugs is fast. It's fast. Because you have more people prescribing drugs and it looks like you are doing something. Nevertheless, let's not discuss the fact that, for example, evidence for antidepressants is weak, to say the least. Okay, it has not been proven that the current generation of antidepressants are really effective in depression, because it has not been proven. Sorry if I spit a little bit, because this makes me really angry. It has not been proven yet that depression, for example, is related to a decrease in serotonin or some other shit like that. We don't know that, but it's fast and it's short term. Long-term changes, like for example, providing more psychological help, which means more professionals that can see their patients every 1 or 2 weeks, and especially making community changes, making changes in the way the society is structured, is very long term and is uncertain. And at least here in Spain, okay, I'm not going to comment on other countries. No politician has a vision longer than 4 years. No one. So this means that when we discuss mental health, we usually are discussing how to give people more drugs. And that's basically it. I don't know if this experience is common to the rest of the countries. I can just offer my experience as a mental health professional here in Spain. And fortunately, the stigma against using the services of a psychologist has gone significantly down since I started working 20 years ago. 20 years ago, you just didn't admit under no circumstance that you were visiting a psychologist. And now I see that is something that is more freely and openly discussed. Okay, and that's what I wanted to say.
Yeah, interesting to hear your perspective, because I just came back from half a year in Valencia, and my experience was different. At least for students, that's obviously very specific population, and I'm surrounded the entire day by other psychologists, so that's probably a very narrow group. But I had made the experience that there is a lot of support for students with mental illness, with disability. And it's something that there are services at the university you can easily access and go to. And also the variety of facilities is very broad in contrast, for instance, to the Netherlands or Germany. And almost similar to the UK. So yeah, I was, how do you say that? I was not shocked, but surprised maybe by your what you told us. But obviously you live there and have years, decades of experience. So I trust two decades.
Two decades. I'm not that old. I'm not that old. I want to make a little. I have, for example, a very close friend of mine who lives in the States. She's getting her PhD over there, and the university pays for their psychology, for the psychological therapy. Here in Spain, as far as I know, no one does that. I'm so happy to hear that around your your country, things are different. Here, not even the most exclusive universities provide this kind of services, which anyway wouldn't be a solution, because only 1 in 3 young persons here goes to college. So that means that we still have 2 out of 3 young persons who don't have any kind of support. Okay, I'm happy to hear that not everything is not so bleak over there.
Yeah. So I think also the University of Valencia is quite has won some awards around their support for students and stuff. So maybe they're the great exception, and the rest is maybe not so good. I think also in the Netherlands, the support is there. There is definitely a student psychologist, and you can go to them, and but you have to wait for a long time. So I see people nodding. Everyone is like, yeah, you have to wait. Yeah, there it's also underfunded, and but there exists. I think in Germany, for instance, even though this is like a great paradox in Germany, psychologists are almost equal to like medical doctors. Like in their esteem, like in their prestige, what kind of grades you need in high school to be able to study psychology. But in terms of like providing support, for instance, for students, it's way harder to get, and yeah, it's still a lot of stigma around it, in contrast to the Netherlands, where there's more access and less stigma, but people think psychology is a pseudoscience, and we do kind of weird mindfulness meditations and help no one. I actually have a little bit of a fun story. My professor did like a mindfulness meditation at my bachelor's ceremony graduation, and my parents are those kinds of people who think psychology is bullshit. And they were like, I see. So 3 years you spent on this kind of stuff. And I was like, no, Mom, it's a science. I do science. But aside from that, I think there's some great variation within different countries in Europe, but also between, I think, the student populations, where university students, where they have maybe access through the university, and they are in general in a more educated environment, and maybe students or young adults that are not in the university context. And we obviously have to be aware that we don't leave them behind, who maybe in general come from a less educated background as well. That was a long story for such a short message, but anyway.
It's fine. Thank you all for sharing. Actually, I'm very happy to see that it's just such a fluent conversation. So thank you for that. I was wondering if we could redirect a little bit more the conversation into which policy making is necessary to do nowadays, because well, as far as I've seen, when there are politicians making measures or designing measures against the COVID-19, mental health is not really something that they bear in mind. So do you have any proposal or any idea that we can transmit to them? So maybe this can get a little bit better.
Anyone?
Yeah, we're well able to unmute ourselves and kick off. I think from someone who sits in the European Parliament, a huge part of actually, I believe, is we're not engaging with those that are working in the fields on a daily basis. I think there's conversations happening inside rooms, or as I like to call the water cooler chat, versus actually having, real conversations with those that are, be it service users or work within in the support sector, as well as carers, because I think that's a really important really important info point for us too. Much to Ramón's point in terms of looking at only 4 or 5 years in advance, I disagree a little, because for me within the mental health space, I look beyond that. I believe we don't best practice share enough. And unfortunately, the only pinpoint I have is what I mentioned earlier around the Finnish model and working with education from a younger age and be more proactive at supporting citizens and really telling people, really sharing that everybody has mental health and well-being, and then having versus crisis mode and reactive care when something when someone needs something. And then our systems, we don't have enough people trained in places. Much to Raymond's point in terms of medication, we're very quick to write scripts and send them off and check in within a period of time. And we're not necessarily sharing the skills in order to support ourselves and equally our citizens. Now that's on I don't want to say lighter side, that's not the correct phrase, but just for people with in need and help of transition periods, I'm saying, like, so from a younger age. That would probably be my biggest call. And then we fund in a very reactive phase. So we fund here in Ireland, we have our main health unit called the HSE, and then they fund other organizations that work within the mental health space because they don't have enough resources, i.e. people, to deliver services, and then they fund other people, and then that's where a lot of the missing supports happen. And again, as I said, the virtual, I hear a lot of organizations getting very comfortable in just delivering in the virtual world, which is great because resources can be kept, particularly if they're fundraising. But I think in 2021, that's ridiculous that we have mental health organizations that relying very heavily on just fundraising from people. And in my previous life working with in a charitable role, like I met more and more parents who've lost family members, particularly their children, through suicide, and then wanted to make something better happen for other younger people, setting up a non-governmental and a charity, and then they're carrying the brunt of the weight on the front line, versus other staff in that volunteer capacity being the main driver of change, versus working in tandem, or the government and policy leading out, and then less and less weight bearing on charitable organizations. And I think our relationship with it's a broken relationship for us. And not to go back too much on it, we see in the Parliament right now creating a European year of mental health is our first steps of trying to create an open conversation. So many, particularly like Nick here, we would have had roundtables with them in the last year or so, just trying to learn from each other, so that every time we put in policy or legislation on any committee level, we're doing so that we're always me and my team are always constantly thinking about the mental health angle. So in terms of migration that we have, this is just an example that we have mental health services on the ground, we have translators, particularly in the context of LGBTQI, that there's a different support system in place for that. And then even citizens within the space, again, LGBTQI, looking at citizens living in Poland and Hungary, how can we get different mental health support services there? So everything we write and we do in my office, we output is within the lens of mental health. And I believe, I would hope that through that and working with, it's not a political issue, it's a citizens issue, which everything is, but sometimes we get lost in the worlds of politics. That's why the likes of AEGEE-Europe, our Mental Health Alliance, the Coalition, helps us to have cross-party conversations and leaving the politics at the door, and we're just always constantly driving forth and being on the same hymn sheet when it comes to talking about mental health. But yeah, essentially the European year is that space for us to embarrass, as I said earlier, attach policy and make sure mental health is being discussed in every committee at every level. And I think, and I could be wrong, but I'm a glass half full kind of gal, I guess, that the fact that we have a health commissioner in place now who has child psychology of a background, and she's passionate about being involved in the mental health conversation and change. We got to strike when the iron's hot. But again, that's a very biased opinion considering I work in the institution. So I can't wait to hear what others have to say.
I could continue in terms of what, I mean, from our perspective, what we try to ask for when it comes to the need to address mental health in this period. We actually produced a paper on the topic, so I think you will find more information on the paper, but very generally, we think that the needs at the moment, if we want to be a bit short, so to say, are three. One concerns communication. I think we have all realized and seen the impact that poor communication can have on people's well-being and stress level in this period. So a lot can be done through adequate means of communication, through a communication that is clear, both about the virus and about all the aspects related to the virus, including right now the vaccine campaign. And this is an aspect that, if already performing in a certain way, can prevent a lot of mental health distress to many people. So, and also beyond the communication around the virus, we also believe the communication can also be important when it comes from institution, and here I'm also including national institutions like governments or governmental bodies, about acknowledging the impact of mental health that the virus is having on the population at large. So also looking into maybe designing and launching public health campaigns that not only concern the vaccine rollout or information sharing about the coronavirus, but also address mental health and give information about what mental health is, what it can be done, why medication is not necessarily the first solution or the most viable solution. So there is a level of communication that is quite important, that goes way beyond policy and legislation. Then looking more at the policy and legislation aspects, we believe that access to adequate mental health care and support is vital. And here is where the conversation can become a bit more tricky, because it depends on the national health system, in which some cases, like the case of Italy, is actually regionalized. So it's a bit difficult to come up with one solution for everyone. So generally speaking, ensuring access to adequate and affordable mental health support that in this period should also be provided online. And then we can discuss to what extent online can be enough. That's another story. But this is something that can be done at the policy level, and this is something that, when it comes to national system, should also be done in collaboration with during the discussion of budget allocation, given that providing some sort of support, if you want this to be accessible and affordable, it also would mean to deploy some financial means to ensure that anyone that needs can access adequate mental health care support. And finally, another point that is maybe a bit more specific to people that have long-standing mental health problems is protecting their human rights. We already see that because of some provision in national legislation, in some cases, people with psychosocial disabilities can be deprived of their legal capacity. And in other cases, people with psychosocial disability are living in residential institutions. And in the case of COVID, we see that places like residential institutions can really become hub for the spread of the virus, and people are forced into isolation. So ensuring that the human rights are protected and not using the urgency of the virus as an excuse to for human rights violation, this is quite important. And again, it goes a bit more into looking at the national legislation and seeing what the system is in that case, because it's one of those areas that is a bit more complicated than simply having European standards. Although there are international human rights obligations that need to be upheld and respected. So I'll just finish here because I think I can speak quite a lot about this, but we have a paper on our website in case you would like to find out more. We go more into also the specific of each of the three kind of pillar that we think could be the policy areas to address.
Just a little, in quotation marks, example I want to give regarding the human rights issues with people with, or for people with psychosocial disabilities. At the beginning of the pandemic, something happened in Germany that I thought would never happen and really shocked me. People with mental health issues, with mental illness, were kicked out of hospitals because beds need to be free for people who could have corona. And this was such a clear point for me where, yeah, it just symbolizes that still today, people don't recognize that mental illness is also deadly, can cause death. And you can not only die from a virus, but also from your mental illness. And that this kind of things still happen today in our modern society was completely shocking to me, and shows how uneducated people in decision-making positions are. And I think from that arises that we really should invest in scientific but also mental health literacy for people in decision-making positions, but also for the wider population. I mean, the entire conspiracy theories that arise at the moment, I think, show that people are really overwhelmed and cannot understand and don't know how to search the right information to really trust in the government regulations and also trust in the vaccines. And I think that's a very important point to change. And in my notes, I just wrote like a simple example. Maybe we need not only PE, like physical education, but also mental education. Why don't we have like 1 hour a week in schools where children learn about mental health and how to take care of their own mental health, mental first aid, stuff like that. So I think that's a simple thing that could be done and could help really, especially in the long term. And what I also wrote down is that at least in Germany, I think we need a restructuring of the entire system, especially when it comes to educating, training mental health professionals, because at the moment, you have to pay your entire training to become a psychotherapist yourself, and it takes a long time. So it's only a very few people actually decide to do that. So even if there is more money for like new clinics or other facilities, they probably won't find the psychotherapist for that, because no one decides to get this training because it's so time and cost intense. and there were, like, a couple of years ago, there was a discussion about this, changing this, but it was dropped. Nothing came from it. So I think that is a discussion we need to revitalize. And yeah, that's are the two things that come to my mind.
Short term, the only obvious answer is to increase the number of psychologists available in the public healthcare system. Around here in Spain, the demand is to have 6,000 psychologists on the public health system because our numbers are way below the average of the European Union. Midterm, I think it's definitely important to get a unified mental health policy in regards to these kind of questions, because one very significant trend that no one is addressing, not the professional associations, not the universities, not the governments, is the regulation of the mental health professions. Here in Spain, we have a severe problem of non-scientific therapies that only aggravate the situation of many persons with different psychological problems, and there's very little done about that. I understand that maybe it's unfair to say this to Maria, but it's the first time I have the opportunity to swear in front of a European parliamentary. So no, but I read that you are Irish, which is a country.
Yeah, no, I was going to say I'm Irish. I'm surprised I haven't sworn yet myself. So no, don't hold back on that sense.
I learned to swear in Killarney. I lived in Killarney for some time, and I have beautiful memories of my time drinking and swearing there. And the thing is, short term, you can increase the access to the general population to psychologists, okay? Because the psychiatric model is, it's under duress, scientifically speaking, because many of the common psychological problems that the population suffers are not biomedical in origin, okay? Of course, I have the utmost respect for the work any medical professional does, and obviously psychiatrists deserve all my respect and all my support, but I don't think that the biomedical model is suited for many psychological problems. Midterm, we need a unified politic to prevent the spread of psycho bullshit, false therapies, fake therapies, because seriously, I don't know around your countries, but here this shit is out of control. This shit is, and I live in Barcelona, which is fortress psychoanalysis, is Kingdom Freud, and it's sickening. And long term, we have to think deep and hard about economic inequality, unemployment, and all of these social problems that we like to discuss, but we have come to accept as normal. Because let's say it again, I said it in my first intervention the other day on Tuesday, I believe. Most psychological problems are contextual problems, and if you want to go deep to the root causes of many mental health problems, you have to go social, and you have to go contextual, and you have to work to ensure things like, for example, this universal basic income. These kind of things are much more powerful from a psychological point of view than any psychopharmac. Sorry, I digressed. Any drug, whatever. But short term, I think that the European Union may do a significant amount of help pushing for a reform of national health systems to include a higher number of professionals, so patients can get a more continuous help. I think that's the first key movement we can do, and this is something that I believe most governments can afford. For example, this year, the number of positions available for new doctors, new nurses, new health professionals has enormously increased in Spain, but so Maria can have this in perspective. When I got my degree and I tried to access the national public system, there were 65 positions for the whole country. 20 years later, we have 140. This is a fucking shame. So 140 new positions as a psychologist for the whole of Spain. And but please bear this in mind. If you get this position, you are hired for 4 years. You have no guarantee of staying after your training is over. So this means we are way below the number of professionals we should have in order to help our population. And as economic crises are hitting Spain hard, we are in a permanent state of crisis. I mean, our best unemployment numbers were absolutely depressing for any standard, okay? We are happy when we have a 10% of unemployment, which is something that in Germany, people would be burning cities to the ground, okay? And we are like, whoa, 10%, come on, let's have some drinks and go out and party. Okay, we really need much more help on that, okay? Thank you so much for listening.
Just to cut you off there, I'll tell the people of Killarney you were asking for them.
Oh, please send them my love. Send them my love. Beautiful country. Beautiful country.
Well, thank you all for your contributions. Now it's time for a short break. So we'll see each other at 16:40, so in 8 minutes sharp. So please bring some water, go away from your screens for at least some minutes, and we will come back soon. Good to see you all. So, Liz, are we going live? Okay.
Yes, give me 1 second because Facebook is actually slow.
Okay, it's fine. All right, so I already put it in the chats, but for all the participants that we have in the room, also have in mind that now is the time that you have the opportunity to also make questions to the audience. Oh, from the audience, wait. You have that you can make questions for the panelists. Yeah, that was the word. Sorry, I don't know if it's obvious, but I'm still nervous. I think it's quite normal, but yeah, it's fine. Also, I want to point out that we have time as well for speakers to make questions to other speakers if you feel like, if you have something that you would like to know also from each other. So feel free also to do that. So now that all the technicalities are covered, I would like to give the word to Alviina so she can also introduce herself.
Hi, thank you so much, Laura, and thank you all. It's really nice to see you and meet you all. And I'm a member of European Parliament. I'm for the first term here from the Greens, and I am from Finland, very north of Finland, actually. And I'm also a co-chair of the Mental Health Coalition with Maria and Cyrus, who have been also part of this event. So we have been working quite a bit together already. Basically, mental health was the main reason that brought me into politics. So actually, my story was so that when I was 15 years old, there was a school shooting in my school. And I found out that the school shooter had tried to seek mental health treatment, but he didn't get it because he was not considered a severe case enough to get psychotherapy or treatment. And then the tragedy happened. And I kind of started thinking about, first of all of the lives that might have been saved if he had gotten the help that he wanted and needed, but also about how our mental health policies are completely wrong in so many ways that there is such a lack of healthcare, and even more than 50% of people who experience mental issues do not get help. And personally, I noticed this also because after the traumatic event, I was really depressed and I tried to get help also, and it was not easy at all. So because of this personal experience, I started pushing for these topics, and I became a city councillor in Helsinki. Finland, where I initiated these open walk-in clinics for mental health care, where one can just walk in and get treatment, a short-term psychotherapy of 1 to 10 sessions for free with no cost whatsoever. And this has proven very effective. Even four times of psychotherapy decreased the depression symptoms by 50%. And I think that clinics like this have the potential to save lives, and I have gotten many messages that imply so. So this is why I've been willing to push this topic also further, and I ended up being a member of the European Parliament as well. Right now, what we have been working on this week has actually been a bit related to that, the access to psychotherapy and mental health treatment. We have been proposing this pilot project, actually together with my colleagues of the Coalition, or the chairs of the Coalition, basically to gain online or video psychotherapy available in different regions in Europe, and see whether it has such good effects that we have noticed already from like face-to-face psychotherapy. So we hope that during this crisis time when it's especially needed, then we would grant the mental health care for the people and give the health care at the point when they need it. Because, you know, if you have to wait for 1 year or something like this, it might already be too late. Everyone knows this who has suffered from depression or other mental illness and issues. So I think that it's really great that I'm able to work with this topic with the colleagues, just like Maria and others. And I'm really inspired that this is also something that has been raised now more in the European level. So I think that we should make mental health a human right. And I'm really happy to discuss it with you. And I'm really happy also to answer all of your questions and comments with my colleagues. Thank you so much.
Thank you, Alviina. So in order to introduce the following questions, I would like to briefly share with you that yesterday I was invited as speaker in the ECOSOC regional session for different topics. So among them, they were discussing mental health, and I specifically was invited for that. And a lot of topics were raised, but among them, one of them called my attention, and is that policies were something that wasn't really there in the terms of mental health. Like that this was a topic that started being discussed more and more, but we really weren't seeing actual policies on the papers and in the laws and being brought up into reality. So this was something that I went a little bit concerned about, because I personally felt like from the citizens' perspective that at least slowly was something going on. But can you please comment on this, or share a little bit more from your perspective from the European Parliament, that maybe you have more information than I have?
Thank you, Laura. I'm not sure if Maria wants to also answer this. I see that she's present, but for me, I must say that I'm not actually part of the EMPLI committee. So I'm unfortunately not like in all of the committee work related to mental health, but I'm trying to push for it from my group level and in the other methods that I have available. I'm in the Foreign Affairs Committee, so that's my main committee. But I find it's really important that what I've noticed as the co-chair in the Mental Health Coalition, when I meet MAPs, many MAPs have ever basically not heard about the concept of mental health or mental health policy. And you know, I even had a member of parliament colleague telling me that in his home country there is no mental illness. So, you know, in European Union level and European parliaments, there is still like, I think a lot of people don't know about this. And I think that's one of the reasons that it doesn't end up in all of the policy papers and documents, you know, that there is so much work to do still for those MAPs who are really active and know and care about the topic. I find like something similar to, because I also like 10 years ago when I was in high school, I started working for climate change matters. And I find here some similarity. Like at the first point, nobody was talking so much about climate change and there was no concrete goals or plans. And now it's moving forward, at least a little bit, too slow, but nevertheless. With mental health, there is, I think, a bit of the same, that there is a lot of stigma and lack of knowledge. And at this point, we are not there yet where we would like move mental health services or policy forward as like important policy area. So I think that's one of the issues here. But Maria maybe can comment also a bit better than me.
Alviina, thank you very much. Laura, will you just repeat your question again, because I missed some of it, if you don't mind, sorry.
Sure. The concern that was brought was that mental health was slowly being in the agendas, but there were no specific policies to be taken in the law by the governments and this kind of stuff. So no concrete measures were found yet.
I see within the mental health space in the EU institution, no specific. Okay, perfect. Now I'm on the same page. Yeah, and much to my colleague's point of view, absolutely. And unfortunately, there's not, and I can agree wholeheartedly with Alviina there. You know, I've had similar conversations with MEPs, both representing Ireland and then within the EPP group, which is where I sit, who were a little bit confused at the start of the mandate when I was bringing up mental health, and you know, people were asking, well, what's your main focus point for the next 5 years? And it's like mental health, and the lack of awareness in terms of why mental health is such a key issue. But I don't, and much to Miriam's point earlier on, and Ramon's, I don't think it's an ignorance towards it not existing. I think it's a comfort level, a vocabulary, and an education around why it exists. How do we support citizens who need help, and support citizens who might not need help right now, but may do along their life journey. And the mental health literacy piece is fundamentally missing, not just at European institution level, but also at local council level, at national level. And then when we talk about it at EU level, it really should, utopia for me is it's across every piece of legislation and policy, every committee level. Hell, I think I would love to get to a point where we're so sick of talking about it and we have everything fixed that we're now looking at other ways to fund other systems from it. But that's utopia. That's where that exists. We have some, and I won't speak on behalf of other groups, but we have some political groups that are very ahead in terms of developing a party paper on mental health, and that's really successful. That's something the EPP is trying to address. And we also have things like, you know, in Ireland right now, my own party, Fine Gael, are looking at policy labs and devising papers, looking at loopholes and spaces within current policy and legislation, how to fix them, and mental health has been certainly one of them. But we're far off, we're too far away from where we need to be right now. And ultimately, that's why coalitions like Alviina and my own, that's how they become required, warranted, and very much needed, so that we can start bringing in more and more people into the conversation, and not just lobbyists, but ourselves, our commissioners, and ultimately the council members, because we need them to dip into national funding, apply for EU funding in order to deliver to citizens who need it.
Wow, thank you for sharing, both of you. I think this is giving a lot of insight to the question. And my next, and I believe by the time final question from my side, and then we will proceed with the questions from the chat, would be, okay, now from what you were commenting, we're still far away from that. How can the European youth, by civil associations, by international organizations, or by any means that we have, how can we support this, and how can we contribute in the advocacy and in being activists in this? Okay, so this question is for a lot of you, so feel free also to just open your mics and share.
Okay.
Sorry, Alviina, do you want to go first?
No, you go first, Laura.
I'll be quick. I mean, from our perspective, as Jennifer was presenting at the beginning of today's session, we're gonna have our annual European Mental Health Week starting the 10th of May. So I think one very concrete action would be for you to get involved there. In many ways, I mean, a lot of it is gonna also happen online. So I would suggest that you probably might want to check our website and the dedicated page for our campaign and see how you can get involved and choose the level of involvement that you prefer and is more comfortable for you. So I think this is a very concrete action and short term. Then I think more long-term action, I mean, without necessarily going down the, becoming activist, I think that in general, first of all, being informed. So keep yourself updated on what's happening and understanding all the different issues and challenges and how these change over time. Another way to be involved is, I mean, maybe it's a bit crass for me to say it, but when it comes to election, get involved there. Not necessarily joining a political party, but really understand who you're voting for, what they stand for, and how, and keep them accountable once they get elected, because that's the other part of the job. So I don't think it's necessary for you to get very much into politics, no, to be an activist from a political level, but we all have the right to vote, and our right to vote is quite powerful. So taking this seriously in a way and dedicated a time to understand the issue and get informed is quite important. And this, I think, are the more general things that everybody can do. Then, of course, if you want to have more of an activist approach, then I would say that once you are a bit more informed and realize what are the aspects of mental health that are more important for you, you could join association. We have our own, I mean, MHE allows for individual members to join, but if you would prefer to do things more at the local level or national level, we have members locally and nationally that can provide opportunities for you to get more involved as an activist or as a volunteer. So here I think it also depends a lot on what you want to work on, and if you want to work on specific sides of mental health, and whether you prefer to work more as a volunteer with people or more at the policy level and then get a bit more of an political activist type of role. I mean, I think there are a lot of opportunities there. It depends on you as well, what's important and what motivates you.
Can I maybe?
Can I? Oh,
Yeah.
yes, go ahead. Go
ahead. What I just briefly wanted to say is that for like activism, or also this like conferences and awareness weeks, I often think there might be the issue that we are talking to people who are already kind of aware of mental health, that they have some knowledge about it, and that's why they're interested, and that's why they join groups and conferences and whatnot. So I think every person, every young adult, maybe in their own life, can talk to people they know that might have some prejudices or need more information, and talk with them about mental health, and try to work in their immediate surroundings to get people involved that are really right now completely disconnected from this topic. I think that would be an important step. I think that's a thing we all can do. I know sometimes I experience that myself. You don't have the capacities, the emotional capacities, or the energy. And sometimes even if I hear something like that hurts my inner core, I'm like, don't have the energy today. And you obviously also have to take care of your own mental health and set boundaries. but I think that is something we all could do.
Thank you, Miriam, for sharing. I think Alviina wanted also to comment.
Yes, thank you, Miriam, for a really, really great point, and also Laura for your intervention. I really agree with them, and I don't want to repeat that. But what I kind of wanted to emphasize was that, for example, in my home country, Finland, we made quite a major change on the topic just in the last 5 years, or maybe even last 3 years. So before that, we had a lot more stigma, and we had a lot more issue about pushing the mental health services, and the services were in a really, really bad situation. And then together with organizations like NGOs, also part of the Mental Health Europe, we started pushing for this legal initiative to guarantee everybody access to mental health care within 1 month as to when they are seeking treatment. And this care meaning not just some pills, but also comprehensive psychotherapy. And I think that this was really, really good way in that sense, that by making this concrete legal citizen initiative, we gathered 50,000 signatures. So we made it to go to the parliament to discuss that. And now the parliament is making a stance on it. But already many areas in Finland are implementing this immediate access to therapy. And already they are kind of putting this into reality. So I think that really was a game changer, because it both changed the service structure and the access to services, and brought the topic to the political agenda, but it also broke the stigma around it, because people were sharing the initiative like, hey, have you signed this already? And it was really just a discussion inside families and with friends, and it became like a thing in social media and so on. So what I learned from that is that sometimes it's really good also to approach with a really concrete proposal on how to change things in your home country. It does not have to be the whole national legal initiative, but also like in your home city or something like this. Because if you want to push for concrete change, then while you do that, you're actually also breaking the stigma, because you're making people discuss the topic. And also what I would like to say is that we can all try to fight for preventive measures as well, not only mental health care, but for example, I have made an initiative in Helsinki about preventing bullying in schools, and also about providing mental health training, like mental health skills training in schools. So these kind of initiatives already can change our world from the beginning. But I just wanted to agree with everything that you said about activism. And I think that politics and activism here go hand in hand. And with both of those, we can change the world.
Yeah, just to add into Alviina's words there, I think change comes about in many ways. Picking up from Alviina's point, there's a number of political newbies like myself and slightly older than ourselves who are looking for solution-based, or even just to see where holes are, and if citizens are passionate about delivering that, then contact your local national or European representative. I mean, I'm constantly trying to organize roundtables for student bodies just to hear what's going on the ground. So then again, that we're constantly info sharing, and that we're actually having honest conversations and being able to take away, right, well, here's the next steps. And if we hit a stone wall, come back and just say, right, where else can we go here to make it work? I think the fact that we feel, and this is someone who's a young leader trying to look at why the disconnection is happening on political level, is the fact that we don't coordinate more of these roundtables, virtual or physical, and actually, shut up and listen more versus talk more. And I know I'm not doing a good example of that because I've been long interventions, but for me, it's a case of the disconnect is happening because behind closed doors, there's decisions being made that are not just impacting the family members and citizens at that table, but most importantly, the vulnerable and the inequality society that Ramón was sharing about earlier. So that's one thing. Another thing that Laura had said is, you know, get involved, get running. 2024, here in Ireland, we have local elections as well as European elections. You know, if you don't fancy being a candidate, then find a candidate that you feel compassionate about. They don't have to agree with everything on the table for you. Your job is to bring them along that story with you and to start chipping away at what society and what community you want to live in. You know, I certainly don't have all the answers around my decision-making table, or my kitchen cabinet, we like to call it. You know, I have people who don't agree with me, because that's true representation of who's living in my communities. And that's how we make better policy. So we're constantly working on from different voices and different experiences and making a more concrete proposals. That's one thing. So run, or find someone you're passionate enough to support with, and start getting ready. A lot of, I know European campaigns, and I know local representatives here in Ireland are already beginning to start shifting and shaping in prep of 3 years' time. So don't wait for the last 6 weeks of the campaign if you want to impact change. Get in now. Equally, NGOs are always looking for people to either run events or be a part of events or just create something. And I'm one of these, if you see a problem and you don't put your hand up, armchair activism is the killer of our democracy. It is ultimately impacting what's going on in our communities, even around the mental health or wellbeing space, around policies, around politics, and the politicking that goes on. So if you and your mates are comfortable sitting in an armchair, that's fine, but it's not comfortable, and it'll continue to be uncomfortable for you all, and most importantly for those that are out trying to make change. So ultimately, get up and get involved. You know, I often get in trouble with my team for saying this, but name and shame in the most respectful way. You know, if citizens don't feel like I'm doing something within the mental health space that's concrete enough for them, considering I spoke about it over my EU campaign, then I encourage people to either contact me or through social media, or through email, or through phone call to say, you promised this, why aren't you delivering on it? Can you tell me what's happening, and ultimately how you can help, so we can make sure, you know, we can do it. And then finally, and I'll wrap up there. You know, if you feel you're out of the loop on something, there is so much endless, because of social media and because of the growth of online, there's so much great content online in order to educate ourselves. Now, ultimately, it's nobody's job here to make better, like, other than probably anybody who's elected, but like even us as citizens, you know, mental health and well-being should have been resolved, support should have been in place, GDP shouldn't be this hard, we should be more proactive than reactive, and it should have been taken care of decades ago, but it's not. And unfortunately, much like climate and the changes we need to make to protect our biodiversity and our environment, we need to make changes now. And if we keep hiding from it, then we're just leaving it to the next generation to clean up our messes. And I'll just say, yeah, don't only take your information from one source, go to many, because there's a lot of different inputs. And when you start listening to only one voice, you begin to think in a silo mindset, which ultimately doesn't change, because we constantly leave people out of the conversation. So that's my 2 cents there.
I would like to add something to what Maria said, and one to the questions. It has been said that one effective way of being an activist is to inform, to get yourself informed about mental health, and I concur. That's a great idea, but I think there are some dangers about it. For example, Maria has mentioned, and she's absolutely right, that there are amazing resources in social media, for example, to get informed. Many colleagues of mine are making excellent communication on mental health, and they are giving lots of useful information, but the useful information is drowned in an ocean of bullshit. And this is something that I don't know if it can be addressed at the institutional level, but for example, recently here in Spain, we had this small scandal about how is in English, family constellation therapist, who said that basically if you were raped when you were a kid, it was because it was your fault, because some psycho bullshit explanation, and well, it makes me want to vomit, so I'm not going to dwell on that. And that kind of content is very popular. We have lots and lots of terrible psychological advice over there. I see things on TikTok that make me cringe when people talk about psychology and mental health. And I think this is something that can be at least partially countered by solid, reliable information coming from institutions, because people still trust institutions. So Alviina, for example, made a point that I find crucial, that is how cost-effective psychological therapy can be, how even a few sessions can make a difference and can help someone who is on a tough spot. And this is something that governments and mental and health representatives can push towards the public to say, okay, therapy doesn't have to be so long. We have this stereotype based on Freudian bullshit that you have to spend years in therapy. That's false. Most evidence-based therapies are really, really short. We are talking about 10 to 20 sessions tops. So we are talking about a very cost-effective way of addressing many problems. And we try to communicate, we professionals try to communicate, but I sometimes frequently feel that we need more support from institutions, from governments, from our representatives, because our message, after all, lacks a bit of push, because we can be seen, after all, as people selling our own business. I mean, many persons can say, okay, Ramón is speaking about mental health, and Ramón is speaking against the primacy of drugs, because after all, he can't prescribe drugs, which is true, and I'm happy about that. But I think that having the support, having behind our backs institutions like, for example, the European Union say, okay, look, therapy doesn't have to be that long. A few sessions can help you a lot. This is what really this is what you really have to know about mental health. This is how you can look for help. It could help immensely. And again, I think this is a very affordable measure. And I think this is not something complicated to do. Oh, and also, please, from the bottom of my heart, please, let's start doing something severe about people spreading misinformation on social media, okay? Because seriously, for a professional of mental health, this is a never-ending battle, okay? They're everywhere. It's an invasion, and I don't, for every piece of information you give, there are 20 bullshit peddlers out there sprouting stupid shit, and we are very alone on this, okay? We feel like we are very alone on this. And I would like a concerted effort, just positive information. Just, okay, this is a list of evidence-based therapies. This is how long treatment usually takes. This is how you get to a psychologist. This is how you can identify a psychologist based on evidence. This kind of information would be tremendously useful to the general population, apart from the other measures we have discussed. Thank you.
I think also a thing that might be rather simple, I can imagine, from policy kind of view, is to make psychology, psychologist, how do you say it, protected term. So in Germany, everyone can call themselves psychologist. And this shouldn't be the case, because then we have some dubious people who whatever did a 6-week course on whatnot and declare themselves a psychologist and really harm people. So I think just, yeah, protecting this term could already help. And I think that, I hope maybe it's not that complicated to do. So yeah, that would be an idea.
Wow, you all made great points. Thank you all for sharing. We have 2 questions regarding the education. One is about the Finnish model made by Liz, and the other is by Leon. Would you like to specify the things that you want to concrete by opening your mix? Because I believe some of them might already have been discussed since the questions were made. So Liz, feel free to open your mic, and then I will give the word to Leon.
Thank you, Laura. So in the session, we discussed the Finnish model with approach to mental health in educational systems like a few times now before. So I've gotten a little bit of a sense of how it is organized differently in Finland. Still, could you share a little bit more on how Finland got to that position? And maybe also which steps that can we take to get closer to the practices that are happening in Finland with regard to mental health in educational systems?
Thank you for the great question. Should I answer already, or is there still someone who would like to?
Go ahead, and later I will go with Leon.
Okay, great. Thank you, Liz. Yes, well, in Finland, indeed, there is a bit different system than in many countries. We have been now developing quite a lot the fact that when there is kind of a physical well-being classes in the Finnish schools already. So that is a bit more extensive than in many other countries, that it's part of the curriculum that you are learning a lot about well-being of the body and so on. And then there's also sexual health and, you know, these kind of things. And we have also tried to make it a lot more modern lately with you know, it's really good. It tries a lot better now to also take like sexual minorities and everything like this in the classes. So I think that's great. Sorry about my bad English. I guess it's been a long week. But then the mental health part, there has not been such an emphasis on mental health in the training previously. And actually, I got this idea because I was meeting with the young persons from high school. And they told me that they are having in the school like a lot of first aid training. Like they are being taught on how to behave if a person gets a heart attack, for example, in a school or somewhere. But then that's actually a really rare occasion. And there is more often a situation when you are in a party, for example, and your friend has a panic attack. And the high school girls told me that there is no education in the school on how to, you know, how to act in such a situation. Like how can you help your friend, or how can you help yourself if you have mental issues or something like this. So this is why, like, I made the initiative in Helsinki to have more of this mental health training. And now it has spread to 8 other cities. So there is now in total 9 cities that there is like an initiative going on to bring this mental health first aid training to schools. It would basically be like 2 days for starters for 9th graders, so approximately 14, 15-year-olds, to have this kind of basic training. And it's something I have also went through. It's a part of like a psychotherapy. Training to be a psychotherapist in Finland also has this kind of a course. So there is good models for that already. And now we're just willing to put it in the schools and already teach these things to the children and young people so that they get a lot more resources, you know, to foster their own well-being and also the well-being of others around them, to get a lot of basic knowledge on mental health. So this is something that we are working on, and I hope that it will become a lot better also in rest of Europe. In Finland, our work is still in progress, but now we are really discussing the topic, and we are having really good projects on this, and you know, it's moving forward. So I'm looking forward to it. What kind of effects will it have for the young people, and especially research on how this will influence the rest of their lives. I hope it will be a positive influence.
Thank you. Now I will give the floor to Leon. Feel free to open your mic here.
Yeah, hi everyone, and thanks a lot for this very interesting talk so far. And yeah, I have a question because we are also just now at the point of education. So from I have the question to the professionals in this round, like from what age do you think this is kind of productive and effective? And how can this be implemented more in the, like, in what concrete form? Like, are there already, like, do we do this trainings like we just heard about, or are we needing, are we in need of a new subject, or where can we include it?
I think you addressed mainly your question to Miriam and me. Is that correct, Leon? Okay, Miriam, please, if you want to go first.
Yeah, I actually saw your question in the chat already and had a little thought about it. And I was thinking that maybe at the age of 8, and 3rd grade would be a good time point, because I think at that point you can discuss certain concepts with children, but also they already have some life experiences that, where they profit from a mental health education. So maybe they're already experiencing grief, maybe a grandparent died, or maybe they have parents with or siblings with mental health issues, or they're experiencing bullying. And I think already there we can address their lived reality. So we don't need to educate them at that point about schizophrenia and whatnot, but about their experiences they make and how to best deal with them. And obviously other more educated people in this area have to develop a curriculum. But I think, if we address the children where they are in their development and in their life, we can already start at a young age. And regarding whether there has to be a new subject, I think in general we lack a subject or subjects, at least in the German education system, that truly prepare children, young adults for life. So maybe a subject that is generally dealing with health, healthy eating, exercise, but also mental health, and then also maybe a subject dealing with how to do your taxes and how to sign a contract and stuff like that. So maybe there has to be some general restructuring in the education system to really not only focus on academic rigor, but also on preparing people for their life and life experiences. Yeah, that would be my take on it.
I'm no expert on developmental psychology, but based on my experience, and particularly on my experience as a father, okay, because at one point I had to explain my daughter what the hell I am supposed to do for a living, because I am a university professor and that part more or less they get, but when I tell them I'm a psychologist and I help people, they look at me like, and what is what you do exactly? I talk to them and what? And so I have to explain to them. I think that I would agree with Miriam. I think that 8 to 9 years, it's an age in which you can start to present some basic ideas about mental health, okay? Particularly, I think that some concepts you may introduce is, the explanation of psychological problems as attempts to adapt or to cope with situations that sometimes don't work. You can explain a bit to them what is to be depressed, what is to be anxious, why some people have panic attacks, these kind of things, that some of these problems may be biological. For example, schizophrenia, it's likely to have some biological cause, though we haven't found it yet. And from there on, you can work, especially at early ages, on taking out the stigma. Okay, sometimes you feel bad and you go to the psychologist and they help you, and that's okay, and you know there's nothing wrong about it. You have them normalized. Then when you are getting close to teenagehood, like maybe, I don't know, 12 years, I would start explaining specifically things about the different kind of psychological problems that are more prevalent in society. For example, and of special importance are some kind of problems that are unfortunately frequent between teenagers, like, for example, feeding disorders, the like. Okay, and the problems and the risks that, for example, social media may entail to them. There are some research that showcases that Instagram, it's terrible for psychological well-being, especially in young girls. So I would start earlier better than later, and I think that you can start introducing some of these concepts and taking out the stigma as early as 8, 9 years, maybe 10. I think they should be fine.
It's lovely how you said that you have to explain to your children what you do. I also often struggle about that with children.
I don't think they understand it, but
No,
well, the youngest is only 4 years old, so she doesn't give a shit, and the oldest is 9, and I think she's starting to get it. And well,
I always say doctor for the mind.
Yeah, no, because I'm not a doctor, not a
no,
doctor.
But
no,
they kind of can relate to that.
No, because I precisely I fight very hard to make her see that being depressed, for example, is not an illness. It's a situation you live in. Okay, it's a coping attempt. Anyway, she's into dinosaurs and she wants to be a paleontologist, so she doesn't care. Okay.
Okay, so we're reaching the end of this panel. So with the last minutes, I would like to ask the panelists one by one to give some final remark in a minute or so. Can we do that? Okay, so maybe we can start with Laura Marchetti.
Yeah. Well, final remark. Well, first of all, I would like to thank you for organizing this event and for having us join today. As a final remark, I guess maybe try to end on a bit of a positive note. I think that if we want to see something positive out of this situation, is that certainly there seems to be more focus on mental health from some of the political and policy-making sides that until now have been focusing on other aspects. So we are certainly looking at the future with a more of an hopeful eye. And one of the piece of work that we are currently undergoing, and it will take a bit, but we hope to get there, is to call for the European Union to have a unified strategy to address mental health and prevent mental health problems. So this is one of our objectives for the future. And then for you, in terms of how to get involved, I hope you got enough ideas and you are also hopeful and motivated to contribute to the cause.
Thank you so much, Laura. Alviina, would you like to continue?
Yes, thank you all so much. It has been such a pleasure to hear your ideas and your really, really smart remarks. And I'm really hopeful that we are starting to have a large bunch of people who are willing to be active and change things in terms of mental health policy and also the ideas of mental health, happiness, well-being in general to bring this society towards a better direction in these things. So I'm really happy to meet all of you, and I hope we can stay in touch later on as well. Always feel free to approach me in any channel, so I will answer and keep working with you all. And I guess that's it. I really think that we can change things, and this is just the beginning, but I hope that there will be a great changes towards the better in the future. Thank you all for your work on this.
Thank you too for everything that you're doing too. Maria, would you like to go on?
Yeah, just to follow up, thanks very much. You know, great conversation and events are not just one-sided, but both-sided. And I love coming away from conversations like this, particularly around mental health, because I actually end up learning a hell of a lot more about the subject at hand, and the change that needs to happen than what I assume. And I think that's what that's experience and sharing is really where we need to be, and the comfort level we need to be at. Much like Alviina, just give me a shout if anybody has if anybody's not seeing something change or move at a European level or an Irish level, and then just let me know positives and negatives. It's always a win-learn environment inside my office. So with that, I look forward to meeting many of you. I know I see Nick at so many events. So if I look forward to seeing you at the next events, and yeah, and just thanks to the organizers, and actually from my side, if you guys have follow-up or feedback from the overall week and have some solutions from that, or holes that you'd like to see changes in, I'd love to see any sort of document or one page or whatever you've got going on, even 1 or 2 lines, just to refocus my mind on what we're doing and move forward. And with that, keep safe, mind yourselves, and thanks very much.
Yeah, thank you. Actually, we were thinking about making some kind of report, because we were having so much input that was so much interesting that, I mean, of course we were expecting something like interesting, but not wow. It was surprising even for the organization. So we're actually thinking about making a report about everything. We'll see how it goes. Miriam, will you go next?
Yeah, also for me, huge thanks. It was a very stimulating discussion, and yeah, I love to talk about mental health, so that was a great experience for me. I think in concluding words, similar to what Maria said at the very beginning, I think the current crisis is such a disturbance and disruption to the current system, with the current way we live, and raises so much awareness for mental health, for climate, for so many things, that it's really not only like a great challenge and crisis, but also a great opportunity for change. So maybe we can look into the future with a little bit of hope. That was very cheesy, but that's how I feel.
Yeah, we need cheesy from time to time as well.
Okay.
And last but not least, I wanted to leave Ramón for the last, as he opened the first introduction of the conference. So now he can close the circle and finish it.
Well, first, obviously, I wanted to thank you, Laura, and the rest of Laura, Neleke, Liz, and the rest of the team for allowing me to embarrass myself, swearing like a sailor in front of 2 members of the European Parliament, which marks a new low in my long-standing career of being a fucking clown. Apart from that, I also wanted to thank you because I think that we psychologists are frequently overshadowed by doctors and medical staff, and we don't get the chance to speak or evidence on our reality as frequently as we could. And of course, I want to thank all the members of the panel for sharing their stories and their points of view. For me, it has been really interesting to have the chance of listening closely to members of the European Parliament, which is an institution that sometimes seems to be very far away to really act upon what we find in our day-to-day. For a short closing remark, and to not take more time, I would like to say that it's critical that all the institutions take a united stand in order to provide information and education to the general public about mental health, in order to break the stigma, help people get affordable mental health care, and also to fight the spread of misleading information regarding this topic, because I think it's truly a public health hazard and a public health danger, how much misinformation and how much evidence-based therapy is out there. So I think this is a really a very important push for our administrations to make.
Thank you so much for your last words. Now, I will just to make a short reminder that we're having our final workshop at 6, so in less than half an hour. It will be again about policy and advocacy on mental health, and it will be hosted by EFPSA. The procedure is going to be the same as the previous days. We're using the same link, and the room will be open for the first 30 participants. So this being said, thank you very much, all of you, for being here. We can give this for concluded.
Thank you so much.
Thank
Thank
you.
you.
Thank you.
Have a lovely weekend.
Thanks. Bye,
You
Rob.
too.
Have a nice weekend.